Good morning, everybody. It's Alistair, aka that pesky social worker, coming at you with part 4 of the anatomy of grief. And today we are going to be talking about the stages of grief. I want to give a quick disclaimer before we get started. Actually, a couple, because a vague disclaimer is no one's best friend. The first is that I have Grace with me. I'm inside today because it's raining outside, so I found a nice little semi-lit window. So I have this little thing sitting in my lap. So if I am distracted, if I look down, if the camera gets bumped suddenly, it's because she's down there. So I just wanted to flag that. So to recap, for those of you that have not been with me the past couple of days, I have been talking about the process of grief, defining it, the kinds, and then grieving versus mourning, and today is the stages. And then for those of you that have been with me, thank you for bearing with me through this little recap, and I really appreciate you joining me today. So today we're going to be talking about the stages of grief, and depending on the different modalities, there are actually anywhere between 4 and realistically 8 stages of grief. I also have my notebook down here, so I'm going to be referencing that from time to time as well, so just bear with me and all of that. Dogs, accoutrement, trying to make it all work. So the stages of grief that we're typically used to thinking of are 5, and that is usually denial, anger, bargaining, depression, and acceptance. Those are the 5 stages that we're used to seeing, and those actually come from a model that was developed by a psychologist named Dr. Elisabeth Kübler-Ross in a book that she wrote called On Death and Dying. Now, what a lot of people don't know about these 5 stages is that they were actually written about the terminally ill person in terms of their personal mourning. This eventually began to be co-opted for the grieving of the friends and family of the person who was dying. So even though those 5 stages weren't meant for grief and loss as we think of it as the person left behind, they were initially for the terminally ill person. They've actually been fused. Now, Dr. Kubler-Ross also had a 6th stage, which is a little less popularized, and that is the shock phase. Now, she is actually not the only psychologist and mental health professional who's posited a theory on grief. Dr. John Bowlby, who was a British psychologist and psychiatrist, actually had stages of grief as well, but he broke them down into 4 stages that are pairs of actions. So if we were to actually break those pairs of actions into individual actions, we're not looking at 4 steps, we're looking at 8. So pardon me while I reference, but Bowlby's stages were shock and numb, which is also in line with Dr. Ross and the less popularized shock phase for that unspoken 6th stage or emotion phase of grief. Number 2 is yearning and searching. Number 3 is despair and disorganization. And number 4 is organization and recovery. So these 2 systems of processing grief actually have a lot in common. There is the acknowledgement of the systemic shock of the loss. I think that even in cases where there is an expected death, where we know that someone, I'm thinking again in hospice terms, when we know someone is terminal, when we know that there is a diagnosis that someone's not going to recover from, even in what we would call normal grief, which I talked about a few days ago, there's still the loss, even though you know it's coming. The best way I can think to explain it to people is that, okay, say that you're, a professional stunt person and you're doing a scene that requires you to be punched in the face. You know that punch in the face is coming. You were trained to take that punch in the face. You know exactly how to take it in such a way to minimize the impact and the damage that it's going to cause you. Does that change the fact that you're still getting punched in the face? No. Grief is the exact same way. It's like that punch to the face. You can know it's coming as much as you want, but there's still going to be that oomph of impact of when that person's actually gone. Anticipatory grief helps with this a little bit sometimes when worked through in a healthy way, because you're already oomphin before the actual impact. So when the person does pass and anticipatory grief is dealt with in a healthy way, that helps to sort of soften the impact occasionally. So we've got that shock aspect that's in common. And the other things that we have in common are, so when I look at the anger and the bargaining, and I think about Bowlby stages of yearning and searching, those read as the same thing to me, because when we lose something, we want it back, usually. especially if it's somebody that we love and care about. And again, speaking in the hospice sense, this is a lot of times where, in the case of the terminally ill person, if they believe in a higher power, I start hearing people talk about praying about how they could have just, X amount more time, be able to do one more thing if, God or whomever they believe in could just take this illness from them. Um, People don't want to accept where they're at, understandably. We live in anti-aging, anti-wrinkle, anti-progression of time society, and we don't talk about death. We don't. We really don't. We are such a violent, full of death culture, but we don't talk about death as the end of a natural life cycle. And that leaves a lot of people struggling with their mortality, on their deathbed, essentially, because it wasn't something that they ever. Humans think they're going to live forever. That's just one of the beautiful, befuddling, wonderful human qualities that we have. We tend to think we're invincible for a very long time until we're not anymore. So, in these stages of grief, I want to note and flag and say that there is something that I like to call a trauma trap and a healing trap, because those are two sides of the same coin to me. And that trap is sort of the illusion that I think a lot of us are under, that our healing is supposed to happen in a linear, logical, formulary way, meaning that it's supposed to be A, B, C, D, and then it's done. The stages of grief don't happen in that. It's like with the classic five, people do not automatically go in denial and then get angry and then bargain and then get sad and then be okay with it. Some people bargain outright and then get mad as hell and then are okay with it. Some people start out okay with it but then end up becoming very depressed, and then it goes all over the road. And I think that that's the sort of disservice and what am I trying to say? Disservice and, I guess, unjust idea that we give people as professionals when we talk about, well, here are these 5 stages and here are these 5 steps and here are these 6 things you can do, because it puts parameters on something that doesn't live in a box. Okay. Say you've got an imaginary purple buffalo that's wreaking havoc on your farm. Okay, you can put up a fence, but because it's imaginary, a fence isn't going to contain it. Now, that's not to say that grief isn't imaginary. What I'm getting at is when there's something that's intangible, meaning you can't touch it, you can't do anything with it, you can't wrangle it. In the case of cattle, you can't hurt it, you can't brand it, you can't put it in a corral. When you have something that's intangible like that, you can't expect yourself to be able to tangibly process it in a linear, logical way. It's just not possible. It's not. You're trying to force yourself to do something on a timeline that is arbitrary. And I don't say that with judgment or meanness. I say that with love and caring and compassion as your social worker, because a lot of what we deal with is self-created. There's again, I'm going to flag this as the trauma and the healing trap. There's this idea that healing's linear, it's a process, it's a series of boxes that we can check off, and that it's something that we should just get through. Healing is not about getting through things, it's about processing and integrating them. It's about integrating these experiences into your life, however pleasant or unpleasant, and accepting the multiplicity of self, all the different aspects of who you are and what you bring to the table, your personality, your skills, your desires, your wants, your needs, your ability to serve other people. All of these are the things that we have to offer as human beings. And none of those are things that fit perfectly in boxes. None of those are things that we can, reach into our brains and say, oh, I'm going to flip my creativity switch today, or I'm going to flip my empathy switch, or as much as I wish some people came with switches, and it feels like some of them did, and they just permanently are stuck in off. The reality is that we're not like that. So if you're somebody who is experiencing any kind of grief because you lost a loved one, a pet, or in the types of grief that we were talking about yesterday, just the loss of your way of life, I really want you to give yourself some grace and some patience in this process, because healing is not linear. Okay? It is not a series of boxes you can check off. It's not a to-do list. It's not organized. It's not clean. It's messy. It hurts. It's emotional. It's very human. And that's why healing is so difficult, because it is so innately human. Our form of healing, because of our cognitive abilities, is different. If we just had to worry about our physical healing, we would be fine. But mental healing is a whole other ball game, and that's something that eventually I'll be moving into later on down the road. But I wanted to talk about just the different stages of grief today and posit a couple of ideas. So just to review, the 5 stages that we're used to seeing are anger. Excuse me, I'm getting it all out of whack because I am not caffeinated. Usually we're looking at denial, anger, bargaining, depression, and then acceptance. Those are the typical 5 stages that we usually see. And that was established by a psychologist. Again, her name was Dr. Elisabeth Kübler-Ross, and she wrote a book called On Death and Dying. Now, another theorist was Dr. John Bowlby, who was a British psychologist and psychiatrist, and he had 4 stages of grief, which he framed as shock and numb, yearning and searching, despair and disorganization, and reorganization and recovery. So those were his 4 stages. The common themes in all of these are that we feel a sense of loss, we feel a sense of shock. We try to reason with it in different ways, either by getting angry about it, by denying it, by getting sad about it. Healthy grief, and what I mean by healthy grief is that we're not in a constant state of despair, is when we are able to move to that place of acceptance. What I want to, again, stress is that healing is not a linear process, okay? Healing is all over the map. It happens in different stages. Sometimes it's 3 steps forward, 1 step back. Sometimes it's 2 steps back, 4 steps forward. It's a back and forth, up, down, unilateral, everywhere, all over the place kind of process. So if you are someone who is dealing with a loss and you're grieving right now, and you're mourning, because we talked about the difference. If you weren't here for yesterday's video about the difference between grieving and mourning, go check it out. If you have not started that process of grieving and then that process of mourning, I really want you to ask yourself, okay, where's a good place to start with this, and where am I sitting with it? So, as always, thank you for taking the time to sit with me, to listen to what I have to say. If this has been helpful for you, I would very much like to know. If it has not been helpful, also let me know. Again, if there's any questions that you have, comments, concerns, drop a comment. Let me know. I love the engagement. I love having conversations with people. Hopefully this gives you something to think about. I hope everybody had a good weekend, and I hope everybody has a good rest of their day, and I will see you again tomorrow. Bye.